In this video, we are going to show you how to perform a diabetic foot examination and what to teach your patient on daily foot care. Diabetics have 20 to 50 times greater risk of amputation than non-diabetics. Foot complications are the #1 reason for hospitalization among those with diabetes. These amputations are preventable with effective care and prevention. Review the patient's diabetic history, blood glucose control, and previous diabetic complications. Ask the patient about previous history of leg or foot ulceration, previous lower limb or digit amputation or surgery, prior angioplasty, stent or leg bypass surgery. Also about smoking and nicotine use, as these are risk factors that contribute to peripheral artery disease. Patients with diabetes and poor glycemic control have an increased risk for chronic ulcers and wound infections. Those with previous amputations are at high risk for ulceration. It is therefore important that you encourage your patients to control their blood sugar by engaging in moderate physical activity regularly, eating a heart-healthy diet, avoid sugar-sweetened beverages, and by taking their prescribed medications regularly. Ask about burning or shooting pain, tingling electrical or sharp sensations, cramping pain in the leg when walking or exercising, numbness and feet feeling dead. Careful inspection of the feet in a well-lit room should be performed at every visit for patients with confirmed or suspected diabetes. Have the patient remove his or her shoes and socks because inappropriate footwear and foot deformities are common contributory factors in development of foot ulceration. Inspect the footwear, look for patterns of sole wear that suggest an abnormal gait or manner of walking and evaluate if this is appropriate for the patient's feet. The footwear should match the shape of the feet and should not be too small, tight or rub against a particular area of the foot. Salah, I'm now going to examine your feet to look for complications of diabetes. Is it okay with you? Inspect the leg and the feet, including in between the toes, and look for the presence of discolored, ingrown, or elongated nails. Signs of infection such as abnormal redness, peeling, redness, blisters, and sores. Hypertrophic skin lesions, calluses or corns, open wounds or fissures. Look for any gross deformities, which most frequently are found in the digits. Check for difference in the temperature between the calves and feet and between the left and right foot. This may be predictive of either a vascular disease or ulceration. Next, I will show you how to identify the loss of protective sensation by using the 10G monofilament. Hold the monofilament perpendicular to the skin and with a smooth motion, apply the end of the filament on the skin until the filament bends and then quickly lift the filament off. These are the recommended sites to apply the monofilament. To maximize the diagnostic value of the test, the 3 sites that are color green should not be missed. The loss of ability to detect this pressure at one or more sites on the foot has been associated with loss of large fiber nerve function. Salah, I'll test the sensation of your feet using the monofilament. This is how it feels. I want you to close your eyes, raise either your right hand or left hand to match the side where you feel the monofilament is touching your skin. Areas of callus should always be avoided when testing for perception. Now I will palpate the foot pulses to assess blood supply to the feet. Palpate for the dorsalis pedis pulse on each foot. This is located lateral to the tendon that extends the big toe. Then palpate for the posterior tibial pulse on each foot. This is located in the space between the medial mellitus and the Achilles tendon. Characterize the pulses as either absent or present normal or present diminished. Now I'll want you to get off the table and walk across the room. Tell me if you experience any pain while walking. Gait or a person's manner of walking may be abnormal when a patient avoids pain while walking. such that the stance phase is shortened compared to the swing phase. It can be a good indication of pain with weight bearing. Take a few minutes to teach your patients on daily foot care. During subsequent follow-up visits, assess patients' adherence to foot care advice and reiterate the importance of daily foot care. Examine both feet every day, including the soles and in between the toes. Immediately report any new lesions, discolorations, or swelling to your health provider. Keep your feet dry. Wash your feet every day and be sure to dry your feet well, especially in between the toes. Avoid walking barefoot even when indoors. Wear comfortable shoes that fit well and protect your feet. Never use hot water bottles on your feet and home remedies for corns and calces. Stop smoking and avoid secondhand smoke. It is through consistent, thorough provision of foot care services and preventive care that we can reduce amputations among patients with diabetes.